Overall, in my opinion, an access needle for percutaneous surgery must be user-friendly. There are many characteristics that define my ideal needle. It must be easy to handle, its tip should be sharpened to pierce the skin without needing to use a scalpel first. It should be stiff enough to allow its passage through the different layers on its way to the kidney, even in patients with previous surgeries or fibrotic tissue around the kidney. It must be robust to prevent its kinking or breakage if some resistance comes across during the puncture. Its different parts might be well assembled and should not be accidentally disassembled when advancing it to the kidney. It must be easily identified and followed under fluoroscopy and, at the same time, easily tracked under ultrasound. Its length should not hamper the calyceal puncture, even in morbid obese patients, and in my opinion, 18 gauge is a good option for its size. The needle in renal percutaneous surgery is used to gain access to the pelvic calyceal system. In my opinion, this is one of the most important steps in this intervention and is related to complications, namely bleeding. The renal puncture must be accurate and should respect the vascular anatomy of the kidney. Therefore, a needle that can be precisely tracked using fluoroscopy and ultrasound is mandatory. NaviGuide has 18 gauge in caliber, and I like the fact that it comes in different lengths from 12 to 20 cm to adapt to the different patient's characteristics. It has been designed to accurately track and guide placement using fluoroscopy or ultrasound imaging. I like its locking hub that keeps the needle securely connected during the puncture, while at the same time it can be easily unlocked to remove the stylet. It comes with an adjustable slider with a radiopack ring and markings on the cannula designed to assist with depth control and aid to limit overshooting. This visual aid is especially useful for those who perform a fluoroscopy puncture with the bullseye technique. I honestly think that NaviGuide fulfills all the requirements of an ideal needle for me. Based on my experience, it is easy to handle, it is robust and pierces the skin without any problem. It is trackable under both fluoroscopy and ultrasound, it is well assembled, and I've had no problems disassembling it. It has good size options and comes in different lengths to adapt to the patient characteristics. Moreover, it adds a radiopack ring and a gripping area that may be much appreciated for those who perform a bullseye technique. In summary, there are many needles in the market, but not all of them have these characteristics that I consider essential for the endourologist performing percutaneous renal accesses. In general, NaviGuide can be especially useful for any case in which the endourologist needs an added precision in the puncture of the kidney. Specifically speaking, I feel especially comfortable using this needle for difficult approaches in which I believe the use of ultrasound is mandatory, such as intercostal accesses or in any situation in which fluoroscopy guidance is not possible. I have tried many needles and I must say that many of them lack some of the features I consider ideal in a needle. I remember a case in which the only way to gain access to the kidney was using ultrasound, and the needle I was given did not have good echogenicity. Thankfully, I had a NaviGuide needle at hand that made things easy for me.